the withdrawals from barbiturates, which is Xanax, Klonopin, Valium, and alcohol are the only two withdrawals that can kill you. Because you go into seizures without it. Your heart can stop. So if anyone is doing alcohol and barbiturates, they have to go to a doctor to get help to get off of it. They can't just stop on their own because they can die. For withdrawals from uppers, like cocaine and meth, really they just sleep for like 3 or 4 days and sleep it off. But the scary thing about that and the sad thing about that is they also get majorly depressed. There's a lot of mental anguish and anxiety and depression that goes in with it. With the opiates and the physical withdrawal on top of mental withdrawal is, how they help you through it. Where I had to go to the hospital for it. They can give you blood pressure medication, which helps. Helps the Jimmy legs, what they call them. You know what restless leg syndrome is. So imagine that times a million with the restless legs, but it's your whole body. And so you're just twitching and uncomfortable and cannot sit still, but can't feel like you can't move because you're so exhausted. For me, I felt like I was constantly walking through sand, like going into a deep swimming pool, but it's all full of sand and I've just got to get across it. And then the vomiting. It was really hard for me to stay hydrated, which is why I had to go to the hospital because I couldn't even keep my own spit down. So it was really severe and had to be medicated for that. And then they might give you a barbiturate temporarily, like Klonopin or Trazodone, to kind of help you through the roughest part of it, and then they take you off of that. Detox centers are great for withdrawals, and so there's free detox centers, like I know the VA has a detox center. A lot of treatment facilities offer detox, and all you have to do is call your insurance and see if they'll pay for it. And with the way Obamacare is right now, insurance companies are more likely to pay for things like that. But it's always a good idea to get a doctor in on it. Even if your withdrawals aren't bad enough that you have to have that, it's always a good idea to get a doctor involved because, you might have an underlying health condition that puts you at a bigger risk. I have a heart condition I was born with, as a child that put me at a higher risk for other problems caused from the withdrawal. So, with that, I can't give any advice on to make someone more comfortable because they won't be. I was doing as much fluids as I could hold in. I would take baths, a million baths a day. If I knew then what I know now, I would probably use like some lavender oils or have a massage therapist come in and do maybe some massages or something. But at that point I was just trying to get through it. So it's going to be uncomfortable and it's going to be painful, heart-wrenching, all that guilt and remorse, that we had been talking about, that's all going to hit you like a ton of bricks. My friend Chris, he shot himself because his withdrawals were so bad. So they're horrible, but you just got to get through them. And there's nothing else you can do except get through them. There's a shot that you can get called vivitrol, and it helps people who have a hard time staying clean. I don't believe it helps them with the withdrawals. I think it might a little bit. But it's kind of a maintenance program type of thing, and there's a lot of maintenance programs out there. I personally was not able to get on any maintenance programs. I wanted to because I was so afraid of the withdrawal. And so I wanted to get on Suboxone, but then I had an allergic reaction to it. So then I wanted to get on methadone, but they wouldn't give it to me because of my heart. And so I really didn't have, and vivitrol wasn't around. It was as readily available as it is now. So I just had to do it cold turkey. And I'm so grateful I did, because if I got on Suboxone, I would still have to withdraw off Suboxone or just be on it for the rest of my life. And I didn't want to depend on a chemical to keep me okay. You know, might as well just get it over with. Just do it. Just get it done. So everyone is different. It depends on how much you're using. So where me and my boyfriend at the time were using such a large amount, and I never didn't have drugs because we were selling it. And so my withdrawals started same day. I was usually using about every 3 hours. So after the third hour, I would start to feel kind of like, just like my legs would kind of start to hurt, like my calf muscles. And that's when I would be like, oh, I better go use, because my calf muscles would hurt. And then by the night of that day, you're just really hating life. For me, it got really bad, but my peak was about 4 or 5 days after the withdrawals began. So mine are really bad, but it's almost like my body would go into shock, and I would kind of sleep a lot with my withdrawals. I'd be really uncomfortable and really sick and stuff, but for me, the worst part of it was the vomiting. And for me, that didn't start till 4 or 5 days. And I've withdrawed twice, and only twice during that whole time. And both times I was hospitalized, and both times it was after the vomiting started. Which is so strange, because, they tested me at the hospital, and, it was about 2 weeks after, and I didn't have the drugs in my system anymore, but my body was still in shock and reacting violently to not having it there. But it's more common for people to have it last a week. And depending when they start feeling sick, depends on when they were using. So if you used only once or twice a day, you're going to get sick after about 12 hours. But if you're using every 2 or 3 hours, you're going to get sick after 2 or 3 hours. You get on this routine and your body gets used to it. And that's like, if that third hour comes, your body starts sending out alarms. Hey, 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 you need to make this better. And because the drugs turns into a survival instinct, that's why your body fights back so hard, is because it's life or death.